days. In today's broadcast, we will talk about hell in Bogota, something that currently is allowed due to COVID-19 in addition to the situation that Bogota goes from yellow alert to orange alert. In Bogota, 6 out of 10 respondents affirm that the right to hell is not being related regardless of whether or not they are affiliated with the social security system, according to the Citizen Perception Survey. This Monday, the mayor of Bogota, Claudia Lopez, shared a district epidemiological committee in order to adopt new measures to face the third peak of the pandemic in the country's capital. The president of Bogota reported that the city went from yellow alert to orange alert, and therefore some measures were taken and orders will be discussed today with the Ministry of Health and Social Protection in a national epidemiological committee. Before leaving for the Easter break, Bogota had an ICU occupancy for COVID of 15.5%. Just 5 days later, we go up with an occupancy of 16.4%, 10 percentage point more, which puts pressure on hospital capacity and places us on alert orange at the COVID traffic light, which forces us to take new measures and prepare to avoid a dramatic peak in the last week of April, said Mayor Lopez. The official announced that the measure will take effect from now on through a resolution issued by the District Secretary of Health. All EPS and IPS are ordered to suspend and reprogram medium and high complexity procedures that may require intensive care units in order to have greater capacity. We are going to work today for 3 things: to enable between 150 and 160 additional ICU each week, maximize the number of texts and maximize the epidemiological fence, she said. Likewise, the mayor reported that 2 EUCI COVID requests to the crew have gone from 52 on average to 140. That is, this rate is necessary to take measures to further contain community transmission and expand hospital capacity, she said. Due to the condition of the traffic light of alert and measures that Bogota adopted for a month, a menu of option and orange alert measures is foreseen, which will be discussed in a national epidemiological committee, which will be brought forward today at 2:00 p.m. to expose the measures proposed to contain community transmission and the impact of the third peak, which is estimated to be presented the last week of April. In addition, around 6 in the afternoon, a meeting will also be held with the EPS and IPS to accelerate the expansion plan of the city's hospital care system, the practice of tests and follow-up cases. At the end of the meeting, the mayor issued some general recommendations for citizens and asked that those people who, when or had social gatherings at Easter, must carry voluntary isolation for a minimum of 7 days to prevent possible new infections. Likewise, it is recommended to stream telework in the next 7 days and apply the drug strategy to detect, isolate, and report people with respiratory symptoms. Well, that was it for today. Thank you very much for always being with us. See you on the night broadcast.